the insurance field changed in the middle 60s, and it made a lot of difference because once they got Medicare and Medicaid, the patients, a lot of the trauma patients didn't want to go to Harborview, and we got a tremendous number of trauma patients at Cabrini because now they had a choice. I mean, they didn't have to go to Harborview, which was an excellent place to be treated, but not an elegant place to be staying. And they could go to the private hospital and have all the niceties that are felt to be preferable. And that was interesting. And of course, the other side of the coin about that time was that a hospital bed at Cabrini, if you were in a ward, it was $11 a day, and if you had a private room or a semi-private room, it was $12. So that it was not a whole bunch of money, but it, you know, the nurses were getting paid, I think, $220 a month. Costs were down, and the surgical prices were down too. I mean, if you did a brain tumor like an acoustic or a meningioma or something like that, and you were covered with King County Medical, you got $450, and that included 3 months of post-op care. And if you did a lumbar laminectomy or disc or something like that, you got $225, and that included 3 months of care. So the numbers were different. And when I started practicing, I think it took me 5 years before I cleared 25,000, and I was working 16, 18-hour days most weeks. Huge change. The numbers change, and the situation has changed. And I think that we gave a great deal of pro bono treatments. I mean, of course, you never charged a doctor, you never charged a nurse, you never charged the clergy, and you know, a lot of people just couldn't pay, and it didn't make any difference. I mean, you took care of them anyway. But it isn't that way. I think it's gotten to be huge business these days. And
I think in this discussion we're having, we can't forget the other hospital that was involved. Strictly from the standpoint of patient care, the medical school didn't use it, was the Marine Hospital.
Right.
And of course, most of the seamen and foreign people and everybody else, foreign seamen, would come in there. And I was mentioning the pain clinic that I was involved in. Once we got through with the research project there, we were able to put the combined anesthesia and neurological surgery research laboratories on the top of that Marine Hospital while it was still the U.S. Public Health Service hospital. And it was really quite an operation up there.
It really was.
An excellent lab.
I did my internship at the Marine Hospital.
Oh, I forgot that. Yeah.
USPHS.
Yeah.
And it was interesting because anybody that was floating on the water got service free. So that means if you're a waitress on a ferry boat or you're working on any kind of a boat, you got total free care. And the thing that struck me in retrospect was that of all the patients I treated, that rarely did somebody say thank you when they left. And it points up to me, and I strongly believe this, if you have something that's totally free, it's not respected. And I think you have to have some kind of a fee schedule, small or whatever, like it was in Norway and elsewhere, that there has to be something that the patient has to contribute to their care financially. And if it's totally free, that's just not going to happen. It's going to be abused. And so I think that's part of the formula that somebody's going to have to figure out in the future.